More often than not, the patients who you're seeing in your clinics will be also taking some form of psychoactive medication. Benzodiazepines, beta blockers, selective serotonin reuptake inhibitors, or other antidepressant medications. So it's very natural that you as a clinician may be asking yourself the question, can I do EMDR with my patient who is taking these substances? We see that increasingly the whole area of mental health is increasingly medicalized, with medication being taken in no small part because there's a lack of provision of psychotherapeutic options. I want to give you a couple of broad guides because I think many of you feel ill-equipped because you're not prescribers. However, you're already very well skilled in regards to being able to assess and to form a therapeutic attunement with your clients. And actually that's still one of the most important things, whether they're taking medication or not. Keep in mind the concept of the window of tolerance. In terms of the medication that a person may be taking, if a person is taking too much of a benzodiazepine, or if they're on maybe just starting on new medication, even if that medication isn't in and of itself particularly sedating, it may be something which is causing them to drop out below the window of tolerance, that they are overly sedated, that they can't begin to stay within a window of tolerance where they can continue to process information. This is something which you can pick up in the room. You need not understand complex psychopharmacology. You don't need to understand the pharmacokinetics of the medication. What you simply need to do is to be able to remain attuned to your client. There is no medication in and of itself that rules a patient out from doing any psychotherapeutic endeavor if we don't include anesthetic agents. Obviously, if I anesthetize you in your sleep, you can't participate. But beyond that, the reality is we're still looking at the broad brush of the window of tolerance. There are some more complicated aspects to medications, some which can impair sleep, which can impair information consolidation after reprocessing, which is obviously what we want people to have. But those are generally more complex, but do not rule out a person's ability to take medication.